Hello everyone, how are you? This is Dr. Samal Noria, your pathology professor, here for you with a small special slide deck that I would want to share with you regarding a discussion basically on why pathology is, as a subject, should be your top priority when you're preparing for your USMLE Step 1 or NEET PG or for that matter, any entrance exam. I have a bit of information that I would want you to look at today. And also, this is to announce that I will be doing my lectures every day, starting from cell injury and inflammation and all those topics. I will be sharing the entire curriculum list with you soon. So we will be covering a lot of topics, a lot of high topics from pathology. And my goal with this series of lectures that we will cover over the next 3 to 4 months or so, my goal is to sort of help you get through, uh, just a read through your textbook Robbins. So I know a lot of you want to read that textbook, but do not feel very confident when it comes to reading textbooks, and the overwhelming information might sort of be a factor that tells you that I can rely more on my notes and PowerPoints that you might have received from your school or from your college and your professors. But trust me on this, that reading your textbook, especially pathology, I will walk you through some of the key points why I am saying pathology. Uh, this can be a big difference in your exam results. So I have personally noticed students who have been excellent in pathology and have their grasp on all of the facts and the mechanism and the processes in pathology have definitely cleared their exams and scored very well in all of the entrance exams. And it also helps you become a good doctor eventually, right? So if that is the goal, which I believe is right. So let me share my screen and share my slide deck with you. And I would want your attention for, another hour or so, less than an hour, right? So let's look at my slide deck here. So I'm calling the title is Why Pathology is the Backbone of Medicine. Okay, and this is me again, Dr. Samal Noria. And if you want to reach out, contact me. Here's my email. It's drsamal at medlearneducation.com. So you can reach me directly through this email. Okay, so let's talk about a little bit on why pathology. I call it the backbone of medicine. Okay, and this slide deck, like I said, what you get through this slide deck is, of course, why pathology matters for exams, for clinical thinking. It's very critical that you are very strong in pathology. What pathology really studies, what do we learn in pathology, what are the four pillars of every disease process. This is very important when you are learning medicine, you're becoming a doctor, right? And of course, you're looking to pass your exams, right? If that's your first priority, which I know it is. How to study pathology using Robbins and using my lectures along with it. So, like I said, my goal with this series of lectures is to sort of help you read through Robbins, plus you can combine it with your lecture slides. And I will be also sharing some notes as we go along, right? Some short notes and some handouts that I will post in every video on YouTube, and you can download all of those handouts. And if you need anything else, of course, I've given you my email, right? And the big thing is when you're learning pathology in a medical school, how to start thinking like a doctor from day one. So that is my goal with this slide deck that I have set up. So we are not going to look at any topic today. It's just an introduction on why pathology is important. If you understand this, of course, you will be learning pathology with me for the next 3 to 4 months. So, like I said, one of the big problems students face is sometimes medicine can feel like memorization. I remember my first and second prof, especially, and those first and second years in medical school can sometimes, and not sometimes, I think most of the times it overwhelms you with a lot of information that you have to memorize, you have to learn the words that you have to memorize. So overall, it starts feeling like a lot of memorization. Topics can feel disconnected across subjects, so you may not be fully aware of how, okay, I'm learning anatomy, I'm learning physiology, same topic across subjects, even if you are in a sort of, topic-based or subject-based curriculums, right? So still they might feel disconnected across, like what are the principles from biochem, what are the principles from anatomy, immunology, microbiology, pathology, how does everything come together? It still might be a little cloudy in the beginning. So especially focusing at the first 2 years of your medical school, okay? And students sometimes they learn the facts, they memorize the facts, like I say, but they cannot apply them, right? So learning the facts is not going to be enough unless you can apply these facts, through the question. So we will also be looking at some questions as we go along the topics, right? Result is confusion in exams, and of course, it so you retain your doubts throughout your career sometimes, and even when you get to your third and the fourth year, and that is your clinical sciences. So the doubts and the topics that were not clear during your basic sciences, you carry them into, with the same mindset, you go into your clinical sciences and you reach a hospital. Of course, you are interacting with the patients, you are in a hospital, you are at a clinic, right? And you're still not very clear around the basic facts and how to apply them, like I said, right? So this is one of the big challenges I see everyone faces. Uh, and now this is where pathology comes in. This is what pathology does for you. This is what pathology helps you with, right? So pathology basically can turn memorization into understanding, right? But this comes with an asterisk, so that asterisk and that disclaimer, and you can say that underpinning fact is that if done properly, if learned properly, right? And I'm here to guide you through that, how to learn this today. So without pathology, facts can remain isolated. With pathology mechanisms, you sort of, you learn a lot of mechanisms and processes and disease processes, and it starts to make sense. It starts connecting everything. Okay, you start to build mind maps, right? And your brain sort of neurons start connecting together and build those mind maps, and everything starts making sense, and eventually you start enjoying learning, which is, I think, one of my goals with these lecture series that I'm planning to do from today onwards, right? And if you understand mechanisms, you can predict outcomes. That is definitely what a doctor would have to do, while you're treating patients, right? Okay, and of course, I know some of you may not be thinking like a doctor, and being a doctor and treating patients. Maybe your focus right now is, okay, I'm looking at, you know, my USMLE step one exam. If I pass that, then I'll start thinking, what to do in life and would I want to be in this career, or it determines, right? Whether you pass USMLE step one determines what happens next, right? I know a lot of you are just limiting yourself to thinking about USMLE step one. USMLE step one questions again are clinical problems where you have to understand the mechanisms to solve those clinical problems and to predict outcomes. Without understanding of pathology, that may not happen well for you. Okay. So pathology is basically the bridge between basic sciences and the clinical medicine, right? So pathology, I've put this in the center of basic sciences, clinical medicine. So it stays here, right? So pathology, is it a subject of basic sciences? Yes, we start learning pathology during our basic sciences, right? The first, second year, and most of the curriculums in medical sciences, if it is not a system based, right, you might learn it at the end of first year or beginning of second year, right? So most of the curriculum is second year for most of the pathological diseases, right? And what I want you to think about pathology is, how I want you to think about pathology is like a bridge between basic sciences and clinical medicine, right? So without this strong bridge, you may not be able to jump from your basic sciences to clinical medicine, right? If you are in India right now or any other country where you have pathology as a second prof subject, right? So, of course, you're maybe planning to write your step one or not, but eventually, when you start planning for your NEET PG exams, definitely the first book that you should start reading and preparing your preparing for your exam for is, of course, it should be pathology textbook, right? So if the base is strong, then of course we can get to our clinical medicine very easily. So in pathology, basically what it does is it sort of physiology here now becomes disease physiology, biochem becomes metabolic disease, immunology becomes inflammation, autoimmunity. So everything connects directly to pathology. If you are very good at pathology, you will definitely be great at physiology. You will start understanding biochemistry more. You will start understanding immunology more, right? So you will start understanding microbiology more. So, and even other subjects, like for example, pharmacology, let's say, for instance, everything in your USMLE step one is a clinical vignette, right? Is a clinical situation, is a clinical scenario. So if you're good at pathology, if they start talking about a disease, at least if you know the mechanism of the disease, everything else would start making sense very early on. So again, specifically for MBBS second professional students, where you have to also write essay type sort of answers, right? Short and long answer type of essays, right? With a lot of mechanisms and classifications, right? So you have to write some short notes, maybe morphology and key features, and then you also have your YY exams, right? Explain the why and the how, and all of the practical aspects of a disease, including the microscopy and gross specimen. So it's very critical that you are very good at pathology. Again, not just to pass your exams, but I say to be a good doctor, right? So why pathology matters for competitive exams is, again, there are a lot of questions that I see on pattern recognition, a lot of images, cross images, histology images, right? Most of the MCQs, so all of the exams that we write are MCQ based, right? So mechanism based MCQs are the big chunk of your USMLE step one or NEET PG exams, isn't it? Molecular markers, genetics is again the next bulk, and lab correlations, clinical integration. So all of this comes from pathology. The knowledge of this comes from pathology, right? So again, like I said, why pathology matters for being a great doctor, because you will become pathologist is like a detective. It's if you like those detective series. I don't know if you watch TV, if you have time for watching a lot of series and Netflix and all that stuff. So all of the detective shows, I like watching those detective shows. And a pathologist basically, and as a student, you become like a detective. You understand the entire scenario. You look at your patient, and then you can predict complications. You can interpret labs, and imaging logically. You can choose rational treatment. So it starts making sense. Everything starts making sense, and it brings you out of your guesswork, right? So it helps you with your communication, a very clear communication with patients, your teams that you are a part of, right? Or you will be a part of one day. So it helps a lot with all of that stuff. So definition of pathology is pathology basically is the scientific study of disease. This is the shortest definition I was able to put together for you, and it basically explains the cause of a disease, right? The mechanism of it, right? The changes that you see in your patient, both grossly and microscopically and clinically, and then what are the consequences? What are the complications, for example? Right. So this is how all of the diseases are going to be, sort of discussed here in all of our lectures when we read our Robbins together. So with pathology, if you look at your Robbins textbook, there are two general sort of divisions to that textbook. One section is called general pathology, and another is systemic pathology. So general pathology topics are overall, in my opinion, and the feedback that I have received from most of my colleagues and students, gender pathology seems more intense, more difficult. I can say the first time you're learning this, right? Systemic pathology sometimes feels very straightforward. because it is all system-wise. So system-wise learning might feel easier sometimes, okay? But in my opinion, systemic pathology would not make sense if you are not good at general pathology, general sort of understanding of what causes cell injury, for example, what causes inflammation, what is inflammation, right? How does healing happen? What is neoplasia? Because in systemic pathology, all these common patterns of injury inflammation is what you are going to learn in systemic pathology, of course, in a specific organ system, right? So if you are very good at cell injury, inflammation, sort of healing, neoplasia, all of these topics from general pathology, you can, you definitely will be very happy applying it to specific systems, of course, with some specific, additional findings in each of the systems, sort of lung, liver, kidney, etc. So we will talk about all of that. And we will cover all of these step by step. But I think a lot of my emphasis always has been on being a very good learner of sort of, general pathology. Having a very good knowledge of general pathology definitely can help you learn your systemic even better and better. Okay. So four pillars of disease, and this is how you should always envision any disease, and this is exactly how my lectures would be, whenever we learn a disease. So it begins with etiology. Etiology is also called as the cause of something. Then pathogenesis is the mechanism of that disease. Morphology is the structure. And then we end with the fourth pillar, that is clinical manifestation. So what I have here, what you see on the screen are four pillars of the disease. Okay. And this is exactly how we would want to learn our pathology. So etiology, for example, I said this is the causation, right? The cause of diseases. So causes for different diseases can be very many. So, for example, these could be genetic causes, so inherited or acquired mutations causing a disease, infections, bacterial infections, viruses, fungus, okay, parasites, environmental toxins sort of causing diseases. So, smoking, alcohol, radiation, for example, immune diseases, autoimmune hypersensitivity, very important topic actually for your exams, nutritional and metabolic factors. So, vitamin deficiencies, vitamin toxicities, right? All of that, protein deficiency, we will talk about all of that. So these are basically the causes of various and different diseases. So pathogenesis, again, like I said, describes how the disease develops. So this is a step-by-step sort of mechanism, and this is where a lot of questions are framed around for your exams. Okay, so pathogenesis should be, out of the four pillars, is a very common focus of what the examiner wants you to know. So including molecular pathways and mediators, of course, a lot of questions on mediators in your NBME exams, USMLE exams, right? Your shelf exams, your MBBS exams, and everywhere. It's these are the important questions, isn't it? So time course, early versus late changes, so acute, chronic, we will talk about all of that. It's very important how the disease develops in early stages, what happens in a disease that turns chronic, right, or late complications. So why complications happen, how, what do they look like, and what we can do about it, right, how we can diagnose these. So this is all covered under pathogenesis. In morphology next, so we talk about structural changes. So we have like two things that you should always remember in pathology. So the first is gross pathology. Gross pathology means what you see. Okay. So without, when if you're a pathologist and you're working in a pathology lab and a surgeon has removed a part of liver from a patient or removed an intestine because of a disease process in a patient and sent it to over to you at the pathology lab. So what you receive as a specimen is the gross, like, okay, so you prepare that, you clean that sort of organ that you've received, and just observing it with naked eyes, right? So that is gross pathology, what you see. Microscopy is what you diagnose under a microscope, right? So you will, process that tissue and, trim it into, and cut it into small pieces and bits and pieces, and eventually create your glass slides that you view under a microscope, right? So that microscopy is what you will do to diagnose, what's going on at the cellular level, at the tissue level in that particular organ that you received. So In pathology questions, you should know both gross findings as well as microscopy findings. Okay, so questions are framed on both, and more of the questions are across microscopic features. Okay, so and in the microscopy, you might see different patterns. We'll talk about all of these. You might see necrosis, which is a form of cell death, inflammation, which is an immune response, right? Fibrosis, fiber formation and collagen deposition. Atypia is when the cell starts developing high NC ratio and hyperchromatism and starts developing atypical features, and it tells you that something is seriously wrong. So these are different patterns that you might see under your microscopy. Okay. And then you can correlate all of these with imaging findings also. So a question presented to you in USMLE Step 1 or NBME or your NEET exams can be framed using all of this information. So you should know how to connect all of this information and piece it together for a particular disease. Okay. And we will work on that. So fourth pillar is clinical manifestation. So what the patient is experiencing, and that is what some of the questions start off with, that the patient comes in and tells you something, right? So, and what you also notice, and you do the physical examination. So all of that falls under clinical manifestations. So these are symptoms and signs. Then you might draw blood and do some blood examination, send it to the lab. You might do some urine examinations, right? So you might do some imaging, so imaging findings, and then talk about the complications and prognosis with the patient. So treatment patients, all of these fall under clinical manifestations of that disease. So these are the four pillars of pathology, okay, or any disease. I mean, pathology is a disease process, right? So science of learning the disease process, basically, right? Okay, so let me give you an example how it flows and how it looks like for sort of, acute appendicitis. So a very common situation that you come across in clinics and in your questions. So acute appendicitis etiology is, there are many, but likely it's luminal obstruction due to ficcolith or lymphoid hyperplasia, right? Pathogenesis, and then pathogenesis is the disease process or mechanism of it now is bacterial overgrowth causing acute inflammation, right? So it starts that immune process called acute inflammation. And then what do you see under morphology? And gross morphology, it might appear swollen, right? In microscopic morphology, you might see a lot of neutrophils, a lot of edema fluid, and maybe possible perforation or gangrene that could have happened in that tissue. Clinically, the patient would have come to you with umbilical pain, some abdominal pain, on the right side in the iliac fossa, or, on right-sided pain, sort of with fever and leukocytosis. So blood is showing you leukocytosis. So all of this is, you know, what acute appendicitis findings are. But if you see, I have covered this topic under four pillars that I just described. So etiology, pathogenesis, morphology, and clinical. So make sure for every disease that we learn, you are able to discuss about and understand its etiology. What is the pathogenesis? What is its morphology, both gross and microscopic? And then what are the clinical features? So if you can do this with me, I will try to break down each and every sort of topic from Robin's textbook for you. If you can do this, then we can win this game. Okay. So again, your roadmap to learn pathology is, I want you to think in mechanisms, right? What is the pathogenesis? Okay, so just not isolated facts. It's okay if you're learning this for the very first time to begin and start learning the facts first. I agree with that. Fact learning is uh, not something that is bad. Fact learning is how every learning begins, right? For the very first time. So I would be giving you certain facts with every disease. I would give you a checklist almost every day with every topic that you can use as learning facts about something. But eventually, I would want you to put all those facts together. So we are moving upwards in our, uh, level of learning. So base level is fact learning and fact memorization, which is the base actually of learning, right? But I want you to go one step higher than that, right? I would want you to sort of be more, towards the application level, right? So application level, definitely yes, but it cannot happen without learning the facts. So definitely we will learn the facts, but we will always focus on application. And I would always want you to think in terms of mechanisms. I would want you to draw simple flow charts if you can. You can use your apps on your iPad, and there are many apps that help you draw and write in flow charts, right? So you can create your notes as we go along learning all these topics, and linking morphology to mechanism, linking clinical findings to mechanism. So mechanism stays in the center, and you should be able to link everything to the mechanism. Okay, why is the patient having fever, for example? Why is the patient telling me that he has pain on the right side, on the flank, right? Or the back or the shoulder. Like, you should be able to link it to the disease mechanism eventually. And most importantly, please revise frequently. This is where you can use your good Q banks, whichever you're using, everything is good. Use them to revise frequently, because spaced repetition has been shown to be very helpful. Okay. So I will talk more about in our lectures how to do this. So research has also backed this concept of spaced repetition, helping you retain a lot of knowledge that you learn from your textbooks and your notes. Why Robbins? So this is the big question today. And why do I sort of rely on this textbook, and how will we use it? So I know some of you might feel that this is an uphill task, and why can't I just rely on my notes and I can use different tools and videos for my learning? So definitely yes, I would not say that you should not do it. Some of you might also want to add the new AI tools and different things that we can use for our learning. So different students might have different preferences. I am happy with all of those tools, and you should be using those tools. But do not miss out on a chance of learning through your textbook. Okay, so are textbooks still relevant in this AI world, and like, have things changed, and have we moved to a different way of learning? Answer is both yes and no. Uh, there is a value that textbook does bring to your learning. I'm not saying that you should only rely on textbook. If you want to use your AI tools, go for it. If you use QBanks, definitely yes. Your lecture notes, mind maps, definitely do that, please. But do not exclude learning from a textbook, especially when it comes down to pathology. And all the more reason why I am sort of, I have thought of doing this lecture series here for all of you, just guiding you through each and every page of Robbins. And I am very confident that we will be doing it together. Okay, so Robbins is the textbook that explains mechanisms very clearly in very simple language. The recent update that they've done in their 11th edition, I will be sharing some of the text directly from that textbook with you. We will be reading some of the pages directly, but I will be sort of compiling all of that information in my PowerPoints, and I will be sharing those notes with you. But definitely, we will look at Robin's textbook and understand through the textbook also, right? Learn this through the textbook, okay? So Robin's textbook explains a lot of mechanisms very clearly. They have updated a lot of mechanisms. If you look at the recent edition, in the 11th edition, I have been doing some reading and research on, for example, necrosis and apoptosis, right? These are, for example, two mechanisms of cell death, and we have been learning about them separately, as two different forms of cell death. But eventually, the differentiation is getting blurred. And last edition of Robbins, the 10th one, they came up with a word called necroptosis, a combination of necrosis and apoptosis. It is getting more and more sort of clearer that, of course, this could be just one pathway with two different sort of forms to it, right? So things are changing. So that is what textbooks bring to us in a very clear format. So Robin's textbook also brings in a very strong clinical pathological correlation, which is what we need for our USMLE Step 1 and NEET PG. High quality morphology description. So the images are pretty nice. I will be sharing all of them with you. And like I said, you don't have to read it alone. I will be, doing this with you. So that's what I have decided, and we will do it together. So how your next 3 to 4 months could look like with these lectures. So daily YouTube lectures, I will be covering one topic each day, giving you short notes outline, which I'll be posting downloadable links in the description. Some key images, core concepts shared through my PowerPoints, right? And we will also try to look at some of the MCQs with each topic, right? And one concept that I would again want you to sort of focus on is that we will maintain consistency, okay, over intensity. This should be your goal in a medical school too, where you should strive to be more consistent, okay, rather than having hard drives full of data. I have seen many students with laptops and hard drives and all of those cloud drives full of data they've gathered from so many resources. There is no need to do that. We do need our textbooks, we do need notes, we do need materials, yes, but everything needs a strategy, okay? I have also noticed and seen students who collect all of that data, all of bulk of 10 gigs, 20 gigs, 100 gigs of videos and lectures and data in their hard drives and cloud drives and not knowing what to do with it. It can be very overwhelming. So I think my suggestion is very clear here. So don't focus on intensity and collecting all of that information. Let's go bit by bit, slowly each day and learn it consistently. Okay. So that is how I would love to work with you. Another thing that I want to highlight today is something about terminology. Okay. So the language of medicine or the language of pathology. So basically, medical words are so important. While you're reading a question, while you're reading a clinical scenario, a clinical vignette, your brain should be able to make sense of each and every word and its connection to the next word in that sentence. So all medical words are basically very logical. They have prefixes, suffixes, which we will discuss with every topic. And if you can break those words down, okay, you can decode a lot of topics if super easily. If you just understand the meaning of, what a word means, the disease, entire disease mechanism, and its process and its complications, everything starts making sense. Okay. And just being very good at terminology can reduce your fear and reducing, chances that you will be memorizing something. You don't need to memorize it. Okay. We do need to memorize certain things, yes, but what you can understand through breaking words down has no match to it, right? Okay. So quick word breakdown examples that I can show you is, for example, hyperplasia. So hyper is more, right? Plasia is increased number of cells, more division. So more number of cells because of more division is what this word means, right? Metaplasia is reversible change of one cell type to another. Dysplasia, okay, is disordered growth, right? This is a pre-malignant change. Neoplasia, neo means new, right? Again, this is new but uncontrolled growth that happens in malignancies and cancers, right? So, so hyperplasia, these are different words. If you can just break them down, so if you understand what hyper means, meta means, dys means, neo means, what plasia means for in each of these, it can start making more sense, right? Another thing that I would want to do here with you is knowing the history. What history? Patient's history? No. History of why we call a disease using certain names. For example, Hodgkin's, Crohn's, Alzheimer's, Parkinson. Do you, by the way, know that all of these are people's names, right? These are different doctors and scientists' names that we use to denote certain diseases. So Hodgkin's is a lymphoma, right? Crohn's disease, Alzheimer's, Parkinson's. So these are just not names. Actually, they probably represent a specific clinical pattern, specific morphological appearance, and specific pathophysiology, which these people described very first time. So Hodgkin's described, or Crohn's described, and Alzheimer's found out Parkinson. So that is why, or it was described in so and so person for the very so different diseases have different histories, which we will also discuss as we go along learning all these topics. So, for example, Hodgkin's described the characteristic lymph node enlargement pattern that happens in that lymphoma, right? Alzheimer, he described the neurofibrillary tangles and plaques for the very first time. If you know this historical fact that Alzheimer described neurofibrillary tangles inside the neurons and the plaques, that is exactly the microscopic appearance of a neuron in Alzheimer's disease, right? So knowing history, I think, can make it a little bit more interesting for you and easier for you to remember facts and either morphology or pathophysiology or clinical patterns. Another thing that I would want you to do is understanding certain stains. I know you don't like learning about stains, but again, helping learning stains can be very helpful while learning for your exams. Okay. Let me give you a few examples. So Zeren stain or Zeal-Nielsen stain is used to sort of stain mycobacteria. So it helps detect mycobacteria, right? Why it works is because it sort of stains the mycolic acid cell wall. So it identifies the mycolic acid in the bacterial cell walls and it makes it pink, right? We call it acid fast, right? If you remember, and the bacilli are also called acid fast bacilli or AFB, right? Similarly, PAS or periodic acid shift stain, it can stain polysaccharides. So fungus cell walls, they have a lot of these polysaccharides. So it helps stain fungus cell walls and glycogen. So it can identify all of these polysaccharides. Silver stains, okay, again, they are useful for staining a lot of fungi and reticular fibers because again, silver has a structural sort of affinity for those structural fiber elements, right? Knowing these small little facts makes it very interesting. Again, history, again, like I said, makes it sticky in your memory. It helps you learn, right? Medicine may not be just facts, okay? If you learn the way I would want you to learn, so it may be because it was historically built on observation and scientists and physicians discovered so many things over years. So if you know that history of how something was discovered and what has the history been for the past 100 200 years and how we came to what we know, that's it. I mean, it makes it very interesting. Okay. So when you learn who discovered something, why they needed a new stain, what problem were they solving, you definitely would remember it for a very long time, right? So this also, ties into sort of a fact that stories are basically neurologically easier to retain as compared to facts and isolated data, right? So if it's a story, definitely you are going to remember it and it makes it interesting and it makes you a good doctor, right? Of course, it helps you pass your exams. Okay, so I know it's all about our exams and passing exams first, definitely, yes, but definitely being a good doctor too, right? So, microscopy, reality in pathologies. One of my students once asked me, Dr. Samal, everything looks blue. I'm unable to, like, it either looks blue or pink, I don't see anything else in this microscopic slide, which is very true, which is what made me remember my first days when I started learning pathology in first and second year of medical school. Histology is the first year subject, and then you get to pathology. Uh, so yes, everything is pink and blue, right? It's very important to understand what is the pink and what is the blue. Okay, so the pink and blue is because of the most common stain that we use in pathology. So most of the slides that are presented to you use a stain called H and E. These are two stains. H is hematoxylin, which stains blue color. Eosin is what appears pink. So hematoxylin is blue, eosin is pink. So what are the blue things in a cell? See, this is very interesting. The nucleus, DNA, RNA. Okay, so if things appear blue in certain areas, so if you know inside a cell, this is the blue area, so that's the nucleus, right? Eosin, proteins, cytoplasm, collagen, the structural components, all of them, they turn pink. Okay, so knowing this again can help you identify what is happening, where it is happening under your microscope. Okay, so what can blue represent? It can be, for example, like I said, it can be DNA inside the nucleus, ribosome rich cytoplasm, so it could be RNA. Calcium deposits happen in many diseases. Calcification is very common after injuries, right? Or as a part of chronic repair process, calcifications can happen. So calcification can appear blue. And we have another word for blue here. It's called basophilic. Baso is blue, philic is to love, right? So basophilic. So basophilia is blue. Basophilic is blue. Some fungus bacteria with special stains again appear blue. Hyperchromatic nuclei in malignancy, they turn more blue actually. So once you start comparing images, you would understand what I mean when I say more blue, less blue. So these are all shades of blue, right? I mean, of course, yes, but there are different intensities of blue color too, right? Uh, I have a sample image of one of the very interesting histology pictures, right? So it's a lymph node actually. So all of these blue areas are where the nuclei are, right? And the pink area is where either it is the cytoplasm of a cell or it is the structural component like the connective tissue, again, fibers, connective tissue inside a lymph node, right? So this is one of the lymph nodes. All of this blue on this side that you see, possibly this blue is very different from this blue that I see inside the cell. This blue is possibly, I'm saying possibly, this is taken out from a surgical specimen. And when surgeons do the surgery, there's certain times use an ink to mark the edge of the resection area. So that may appear like this blue. Okay. So I'm assuming that that is the case here. Okay. So let's focus on this lymph node here. So inside the lymph node, you see certain areas, and I picked this very interesting image of a lymph node where I see a lot of granulomas here. So all of these round areas are granulomas. I see a lot of macrophages, a lot of epithelioid cells. Okay, giant cells here. Okay, so this is a granulomatous disorder, and we will talk about this in detail as we go along discussing. So, and what we will do is I will make sure that I show you images at low power and images at uh, higher power of microscopy. And for that matter, we can also I would be finding and showing you some of the images that you can sort of use as virtual microscopy images, and you can basically zoom into them and visualize each and every cell at a more sort of magnification power. Okay, so we'll try to do that. We'll cover all of that. Okay, so this is how, I mean, different things can look like. But again, like might still tell me, okay, Dr. Samal, again, this is all blue and pink, and I would say yes. Okay, so don't worry, we will learn the topics as we go along. Okay, and I will show you all of the features that are present here. So again, 5 questions that can make you a pathology thinker. I would say, what is the etiology first? So what has caused it? What is the pathogenesis? What is the key morphology? Okay, what clinical features should I be expecting? What complications now can occur in my patient? Okay, so if you can answer these questions again for every disease, this can make you an excellent person who will have a command over pathology will pass their exams and be a good doctor one day. Okay, so in closing, this is my last slide today for you. And this is the last thing that I want to say today is uh, let's have a commitment here. Okay, the commitment is uh, one thing from you, one thing from me. So I will commit and you will commit. Okay, so we'll do a 200% commitment. I was recently at a conference and we had invited a keynote speaker from the US to speak at our conference that we organized through our department here. Uh, and he talked about a lot of things, including one thing that is, one of my favorite things that I picked from his talk. He talked about 200% accountability. So 200% accountability is 100% from my side and 100% from your side. Okay, so we will make it 200%. So your promise should be that you show up daily, you watch my videos, okay? Don't have to binge, sort of watch all of these. Of course, I will be compiling the playlist as we go along, but every day would be easier, like 30, 45, 50 minutes or so, depending on the topic. So if you can do it every day and then you can revise, set up a schedule and revise. Okay, I can help you do that too. My promise is, of course, I will help you guide through the Robbins textbook. Most of it. If we have time, we can do all of it actually. Okay, so that is what I would do with you, and we will build very strong foundations one day at a time for the next 3 to 4 months. Okay, and you can subscribe to this channel so that you get regular updates, and we also post questions on this channel, and all these videos that you are watching now is one of them. So also with every video in the description, I would see if I can attach the notes outline and short notes and short questions for you every day. So that is my promise. Okay. So that's it from my